Can everybody hear me okay? I tend to project relatively well, so is there noise issues here at all? Okay. All right, so you may or may not know me. I've been around in long-term care for a pretty long time, since 1992. It's myself and my colleague sitting up front up here, Sean Cripps, that we do the licensing for long-term care. Now, just for the second, I'd like you to kind of like separate in your minds licensing and certification, because right now in the state of Michigan, these are two different functions. And when Sean and I come into your building, we are operating under the authority of the Michigan Public Health Code. And that's where this law that Adam has presented, it's Michigan Public Health Code. Well, there's a couple of different codes, but there's essentially the same. I'm going to use the Michigan Public Health Code, but it's MCL 333-20173A. That's the authority under the Public Health Code that sets up this whole system. And when you have your certification survey, those surveyors, this is the annual, your regular annual certification survey, those surveyors come into you under the authority of the federal health, the Federal Code of Regulations. So we're talking about two different licensing sets, and we look at this particular requirement a little bit differently. But I will say that those of you who get that certification survey, those surveyors do have an FTAG, I believe it's F606, that prohibits a licensed facility for hiring individuals. And I can't remember exactly what the language is, but you can kind of take it, those individuals who have been convicted of an exclusionary crime. But when Sean and I come in, we're specifically looking at your requirements under the Michigan Public Health Code. There's a little bit of differences, and so you might say, well, why don't our federal surveyors, or why don't our certification surveyors use the same criteria? It's because we're acting under two different licensing codes. So that's the beginning of it. Let's see here. All right. So some of these slides will reiterate some of the points that Adam made. Adam talked about the back end of this process, what I call the miltcpartnership.org website, the actual application. I'm going to talk about what happens when we do an audit of your what we're calling it is an eligibility clearance letter audit, or a fingerprint result audit. So this is what's going to happen when we come into your facility to look for this documentation. And just as Adam said, there are three categories of quote employees, and actually only one of these categories are truly your employees. That's employees who you have hired directly, who have regular contact with residents. And then the second category is those contracted employees who have regular contact with residents and or with medical records. And then the third category is individuals to whom you have granted clinical privileges. And I'm going to elaborate on each one of these little categories. First thing I want to say is that in terms of folks that you hire directly, you have this nailed. So congratulations. I have yet to walk into a facility for the most part and not find that any individual who you have directly hired, before they start working, you send them out and they get their fingerprints. So that category is fine. But it's these second two categories where there's a little bit of uncertainty, let's say. All right. So first of all, what's meant by clinical privileges? In the Michigan Public Health Code, there's a number of definitions. But one of the definitions that is not in the Michigan Public Health Code is what is meant by clinical privileges. Now, hopefully sometime in the near future, the Bureau will be coming out with some administrative rules that will address the eligibility clearance process. And there have been some proposed wording for this. But when Sean and I come out, I like to use more of a common sense type of a definition. And I like to say that someone who has been granted clinical privileges is someone who writes orders, or at the very least has the ability to make notations in your clinical records. But that's what I call a common sense type of a definition for those you have granted clinical privileges. So it's mostly going to be your medical professionals, your physicians and nurse practitioners or physician assistants who come in to your facilities to evaluate residents and to write orders. You'll notice that this definition excludes somebody who would be considered to be a consultant physician. For example, there are many cases where your attending physician wants a particular resident to be evaluated by another health professional that they don't have expertise. For example, a dermatologist or an infectious disease control professional, and so they will send the resident out possibly with a request for consult. The referring physician might do some notations in regards to a little bit about the resident's clinical history and please evaluate and recommend treatment. The resident goes out and sees this consultant physician and comes back with some recommendations, and then those are ordered by the attending physicians. In that case, those individuals would not need a clinical we would exclude them because they really don't fit the definition at all. Okay. What's meant by regular access or contact? Well, we actually don't have any definition for the frequency of contact. So again, we might have to use some common sense definitions, and I'll get to that in a later slide. We do have a definition of direct access. That's in the Public Health Code. Public Health Code says direct access means access to a patient or resident or to a patient or resident's property, financial information, medical records, treatment information, or any other identifying information. So again, it's folks who have access to their medical records. So that brings that particular aspect into this part of the definition. I have done licensing surveys in places where, especially in the Upper Peninsula of the state, and in some of those locations, it's very difficult for them to get mental health services and sometimes some other services. And some of those facilities have resorted to using telemedicine. Is anybody here using telemedicine? Okay, so in those cases, you might say, well, does someone who sees my residents by telemedicine, would they be covered? Well, my question to you would be, do these individuals write orders, and do they have access to the medical record? So if you answer yes to both, they're providing a service, and they have access to them. They may not be in the same room, but they have this access. Then I think you need to consider them as being individuals who need to have that background check. Now, you wouldn't have any obligation to obtain eligibility letters for like a lawn care staff or some of the other vendors that Adam referred to. And you might not be obligated to obtain an eligibility determination letter for an employee who, say, spent 100% of his or her time in a service wing or in the basement of the facility. But again, I need to ask you to think about this very critically, because where does this employee enter and exit the building? Would the employee have access to residents when they come in and when they come out? Because even though they're not working in that particular area, they still might have access to them. Where does the employee take breaks? That sort of thing. Where do they have their lunch? So those are some things that I would ask you to consider when you think about, well, does this individual who works in my service wing or works in the basement, and then there might be other times when you need additional manpower or woman power, so to speak, and you ask that particular employee to do functions other than what they normally do, that brings them into contact with residents. So do be careful when you make that decision. One of the things that Sean and I do when we come into your building, to do these particular audits, we will take this into consideration. So just be careful about that. So what's involved in an audit? We will select some randomly chosen employees, and we will ask for that eligibility determination letter. You may also know it as a fingerprint results letter. And the important thing is we want that letter to have both your specific facility and that specific employee. So here's a picture of this, of the documentation, and this is really and truly the documentation that we want to have. And you can see I have redacted some names, but down there where it says subject and there's a name redacted, that should be the name of the employee that we have asked about. And then that should be followed by your particular facility. And that's all the documentation we need. You give us this letter, and we consider this to be the documentation that you have done your due diligence on that particular employee. And as Adam said, if this letter has another facility's name or another agency's name, we can't accept it. It's because of you're not in compliance. It's because of the wrap back. Because, for example, let's say that you have a contracted physical therapist, and you know that physical therapist could work in many other settings, a hospital, an outpatient setting. Well, neither of those settings are what Adam referred to as covered providers. And so their company wouldn't have any idea that that individual couldn't work, where they could work and where they couldn't work. So that's why it's really important to have your name on that letter. All right, so who are we going to ask for? Who are we going to include? Well, we're certainly going to look at new hires, just to make sure that the most recent hires have been through this process. And we're also going to ask for interim staff. Now, I will tell you that every now and then I go to a facility and there's an interim DON or an interim administrator who works for the corporation. Do they have an eligibility letter that has their name on it? Who has their name on it and the facility's name on it? Unfortunately, not always. So anytime you say you have an interim, you need to make sure that you have that letter. And by the way, do look at your corporate consultants who come into the building to help out your staff. Frequently, they're in the units. They're helping the nurses. They're helping with your MDS and your care planning process. They meet all of those. They meet all the criteria for the employee that needs to have the background check. So just because they're on that corporate level does not mean that they're excluded. If you're here from a corporation, you might, one of the things that Adam said, when you first hire somebody who's a corporate consultant, you might consider having them underneath every single one of your facilities, just in case you need to send them there. Because if it's more than 12 months, they'll have to have another fingerprint. It's just something for you to think about. I'm also probably going to ask for employees that have the oldest seniority date. And that, remember that this process goes back to 2004, right? 2006. Okay. So, but more than a decade. And there was a very short time, and maybe Adam remembers, but at first, because we were working under a federal grant, all employees, when we first started in 2006, were covered as far as the payment. And then we ran out of money. And it wasn't for a very long time. I want to say till 2011. But it came back in about 2011. Extended. But what happened? There was a very short period of time where we said that employees could be, quote, grandfathered. But when we did that extension that Adam was talking about, we said that all your employees needed to be fingerprinted. So I sometimes will look, if I see someone has been working in your facility since 1998 or thereabouts, sometimes I'll say, let me see that person, just because I want to make sure that employee didn't fall into that trap. I'm going to ask for your medical director. Now, medical directors, as you can probably tell, might be someone who falls in between. It's certainly someone who probably has clinical privileges and someone who is contracted. But what I have found out in doing this is that the medical director happens to be, it's not 100% of the time, but if there's an individual who hasn't ever had fingerprints, it could be your medical director. And so please make sure that your medical director, especially medical directors that have been with you a long time, are in this database, because they have to have a letter as well. And that goes for all of your attending physicians and medical extenders. Usually ask to see one or two of those as well. I've already mentioned the corporate consultants and, of course, your therapy staff. Now, obviously, there are a couple facilities that do directly hire their therapy, but not all of them. The majority of therapy is a contract. You want to make sure that you have them. And if you happen to have contracted food service, housekeeping, laundry, and or maintenance services, make sure you have it for them as well. Okay. Dentist, podiatry, vision, hearing, and mental health services. Especially mental health services are probably going to be writing orders. So they kind of fall in between that, or they're a combination of contracted services and individuals who have been granted clinical privileges to. But even your dentist, your podiatrist, vision and hearing, they are contracted to provide services to your employees. They probably come into your building on, it's probably not more than once every other month as most, or once every 3 months, but they regularly come into your building, so those would be covered. If you don't already have a full-time or a part-time dietitian who's a direct hire, if it's a consultant, your consultant dietitian, your consultant pharmacist, even though your pharmacist is not seeing residents, but they're reviewing their medical records, they're providing services, so they meet that definition, we will ask for them. Agency staff. So if you have to use an agency for either your CNAs, your nurse aides, or your nurses, or anybody else, you're going to want to make sure that you have eligibility determinations for them as well. If you contract security, if you contract transportation. Now, I'm not talking about the kind of security that just drives around your building. Those, not those. But many facilities in our more urban areas do contract with a security company to sit at that front desk, especially in Detroit or Flint, sometimes in Lansing, Flint. And so those individuals must have a background check. And if you have a contract with a transportation a company, say that you are sending residents out for dialysis, is probably the most common use of a transportation company. Those individuals, those also must have background checks. X-ray technicians and phlebotomists. They're contracted employees. They come into your building. They draw blood for a phlebotomist. They do X-rays for the X-ray tech. Now, you will find, since we started looking for this, well, let me wait to the end, and then I got to tell you, I got to make a confession to you all. But what I have found is that when you have a contract with either a mobile X-ray or a lab service, that they tend to send the same 2, 3, even 4 people on a regular basis. So it's those individuals that you need to be concerned about. Of course, your hairdresser or barber or nail technicians who come in, unless they're volunteers. Occasionally, a nail technician will be a volunteer. The same with massage therapists, music therapists, if they're not volunteers. Those, they all need to have be in the database and be the best. I'm going to answer questions at the end, so give me a chance. Now, here's where I'm going to make a confession. Even though Adam says the change to the law occurred in 2011, it wasn't until June of this past year, June 2018, that Sean and I understood that we were under a misunderstanding about how the law was to work. And up until June of 2017, guess what? We were not asking for these contractors to have, I'm going to go back to that fingerprint result letter. We were not asking for this, again, where I have redacted, that would be the contractor's name, whether it's the phlebotomist or whether it's the nail technician, whomever, and your building. For example, it might have the physical therapist name, and it might say Select Rehab. We were fine with that. Even we were just not apprised of the change in the law, and now that's why some of this is coming back to bite our butt. Who are we not going to ask for? As Adam had said before, we're not going to ask for volunteers, and we're not going to ask for students. However, again, I am going to ask you to be very careful about students who might have clinical privileges, and I am referring here to medical residents. So we have a couple of facilities that I'm aware of, and maybe more than what I'm aware of, who get attendings from local family practice, from a local family practice, and a local family practice who has an agreement with one of the universities to be a practice site for resident physicians. So you would need to look and see, or we would need to look and see, well, if we came in to check on this, what exactly are resident physicians doing? Do they have every single one of their orders co-signed by the supervising physician? Do they see residents in the presence of their supervisor? I don't know. I don't really know how that goes. And only you can answer those questions. But I am going to ask you to be, if that's your situation, to be very careful about that. On the other hand, do recognize if you are allowing, if you're saying, well, we're going to allow resident physicians to see residents, write orders, do documentation under their supervision of the supervising physician, the supervisor. You do need to remember that you have to accept that liability. I'm saying that as a surveyor. The next group of individuals that I'm not going to ask is going to be hospice staff. Now, hopefully this is going to be one of those things that will get cleared up with the state administrative, the new state administrative rules to address this process. But here's what I'm thinking. Hospice is a covered provider, meaning that hospice operates under the same law. That if a hospice employee, if a hospice HR were to receive a rat back on one of their employees that they had been convicted of an exclusionary crime, that hospice is under the same obligation as you to terminate immediately. So that hospice employee would not show up in your building. And that's why I'm not going to ask you for a fingerprint result letter or clearance eligibility letter for a hospice employee. I'm also not going to ask you for those contracted employees who come in intermittently, and I'm just talking about the phlebotomist and the x-ray technician or possibly an agency staff person who would only come like once and then not show up again. I'm not going to worry about those, and I'm not going to ask. But what we will look for are these contracted employees who show up on a relatively regular basis. And the standard that I personally use, I say, well, let's look for someone who has been in your building at least 3 times in the last 6 weeks, once every other week, that sort of thing. I consider that to be pretty much regular, and those I will ask for. But if it's less than that, if it's a one-off, that one I'm not going to ask for. Okay, so let me just say that if during a licensure survey or audit we come and we ask for one of these letters and we don't find it, you're going to be in non-compliance with the Michigan Public Health Code, specifically MCL 333-201-73A. You know I had to said that a lot to be able to let it roll off my tongue. So that's what I usually say. And if we find that you are in non-compliance with that, what we're going to do is to ask you to show us that you're in compliance by sending us the completed letters for those individuals that we have identified. I want to talk a little bit on Adam's territory, just a teeny little bit. And the first thing I'm going to say that if whether you are the HR person in your facility or whether you are the administrator, learn to use that contracting agency screen. Because just to go back to that list of individuals who could fall under a contracting employee, there's a lot. 5 minutes? Oh dear. Learn to use that. If your vendor has registered, it's going to be easy for you because they can supply you with the employee's confirmation number, their date of birth, And then what you will need, as Adam had said, you need to get that employee's consent for that background check. And then even if the employee is found, you still need to go through those 5 registries, because our system is not up to date. It doesn't up to date. There's an issue that someone can be on that contractor screen for more than 12 months. And so they could have been in the FBI database and no one would know. So just be careful with that. Now, here's what I got to say. You must beware, because not all of your contractors has registered as a contracting agency. If there's anything you should take away from my part of the presentation, it is this piece here. It is your responsibility, if you're the administrator, when you look at your vendors, you need to, when you talk to your venues, when you renew a contract, you need to determine whether or not that vendor has registered, because as Adam told you, they're under no obligation. The obligation is yours. Again, like I said before, if the vendor has registered, your job at that point is easy peasy. But if they haven't, it is your responsibility to make sure that you somehow get that contracted employee, and when I contracted or clinical privileged individual, you have to get them into that healthcare database. It is your responsibility and not your vendors. But you can talk to your vendors when you negotiate those contracts. I'm done. I don't think you have this, but this is the number in Lansing. If you need to send me email, it's zabitsb@michigan.gov. I'm the only Zabitz, so there's no number. It's zabitsb. Sean Cripps, I think she's the only Cripps. Chris Cripps at michigan.gov. But just make sure in your subject line you say questions about the eligibility audit presentation, so I don't put you into some other category.